Hi, my name is Karen Smith. I'm an analytically oriented psychotherapist, and I have been doing some video blogging, and I also have some written blogs, and I thought it would be good to do a video where I said something about what my training is and my approach to work in case people were interested. So I'm a social worker. I'm a clinical social worker. I got my degree at Bryn Mawr, my master's, and that's what provides my access to licensing. There are different degrees that you can use to become a clinician. You can become a social worker, a psychologist, counselor. Sometimes psychiatrists also get training to become therapists. But I did it with a social work degree. But a master's degree is kind of a spit in the bucket if what you really want to do is serious long-term clinical work, which is what I do. So after I got my master's, I went and I did a 2-year advanced clinical training program, which is something a lot of clinicians do. You can do them in different fields. You can do them in either an approach to therapy like Gestalt therapy, or you can do it in a type of therapy like family or couples therapy. I did mine in object relations theory and analytic theory. So I went to the International Institute of Object Relations Therapy in Bethesda, Maryland, which is sometimes referred to as the Scharf's School because David and Jill Scharf are the head of the school, or the heads of the school. And it's now called the International Psychotherapy Institute. And it was great, but I actually did it when I was young. I was in my early 30s and green as a therapist. I had worked mainly as a social worker, like social worker advocate, politics, case management, counseling, the first 10 years of my career. So when I went to the Institute, a lot of it went over my head, truthfully. I got a general feel of it. I had some incredible experiences, but a lot of it went over my head. So when I got back to Philadelphia, there were a couple faculty members from the Institute that practice here, that have their practices here and do lots of training here. And so I started to train with them. And I trained with them in a specific format that is really one of the best learning vehicles, which is they were like 10 to 20 week seminars. Each seminar was focused on a specific either aspect of theory, like the Oedipal complex or dreams, or a specific theorist like Melanie Klein. And we would read and unpack really complicated material with each other in these 2 to 3 hour groups every other week for 10 to 20 weeks. And I did that actually for almost 12 years, 2 or 3 of these seminars a year for almost 12 years. And I now run them myself, where we look at the material together as a group, apply it to cases, apply it to ourselves, apply it to our kids and partners and everyone we know as a way to really kind of understand and grapple with the material. So that's really, I would say that's where I came to identify myself as being able to do analytically oriented work. So I don't do analysis, and maybe I'll do a blog on what analysis is as opposed to psychotherapy. But what I do is psychotherapy, which means I see clients usually once, maybe twice a week. I see them on the couch, usually face-to-face, although I do have some clients who I see laying down on the couch where I'm sitting behind them. And I'll definitely do a blog about that because it's interesting how different the work can be on the couch as opposed to face-to-face. I also do lots of couples therapy. What I don't do is technique-based therapies. What I don't do is short-term interventions. I don't do CBD or DBT, and I can talk in another video about what those things are, and they're certainly great. They have their place, as does long-term psychotherapy have its place. And what I would say my work is like, what I would say my goal in work is is to help people develop a relationship with their unconscious self. So often people will say things like, I don't know why I keep doing this. I keep doing this thing. I really don't. It's not what I want to do. I've been trying to change it for years and I just don't understand why I keep doing it. Well, the answer to that is in your unconscious self. And so that's one of my main goals in treatment, is really to help people connect their conscious thoughts with their unconscious thoughts and to help them notice when there's discrepancies. And we do that through dreams, for sure. They're a great vehicle to information about the unconscious self. But so are random associations in sessions, random thoughts people have in the middle of a session that they might think are completely irrelevant, but which are actually incredible keys to clues, to information about what's going on with them. So I hope this gives you a little information about me, and I hope you're interested in my videos, and I hope if you do that you subscribe and you share and you like and you do all the things that help move these videos forward. Thanks so much.